Hello and welcome to Paincast, Conversations on Pain and Physiotherapy. This podcast is brought to you by the Pain Science Division of the Canadian Physiotherapy Association. I'm Tiffany, the host of Paincast and an executive member of the Pain Science Division. I'm a physiotherapist in Toronto. In this episode, you will hear two fascinating pain stories side by side. Jules and Georgia are physiotherapy students in the Pain Science Division Student Committee that I run, and both have lived experiences of pain. We talked about the profound effect of pain on the whole person, but how that has changed over time and what living well with pain looks like for them now. These two stories also portray how pain education could be troubling and transforming, how pain education should be like from the patient's perspective, and the intricate interactions between mechanical and non-mechanical drivers of pain. Before we start, as a reminder, Paincast brings together researchers, clinicians, students, and patients to facilitate discussions, knowledge translation, and critical thinking on topics about pain and physiotherapy. The views expressed in each episode are of individual guests, do not constitute medical advice, and do not represent the views of the Pain Science Division or the Canadian Physiotherapy Association. Enjoy the episode! Hi, Jules and Georgia. I'm excited to have this conversation with you too. How are you doing?
So good.
Yes, very good. Thank you for having us.
Yeah, thanks for having us, Tiffany.
Can you introduce yourself to the audience?
Sure. My name is Jules, and I am a second year physiotherapy student at the University of Alberta in the Edmonton campus. And I'm from BC, so I'm not from Alberta.
Learning something new here. And I'm Georgia. I'm a first year PT student, also at University of Alberta, but on the Calgary campus.
So, for the audience, I met Jules and Georgia through the Pain Science Division Student Committee, which is something that I lead every year and have students participate in producing a podcast as well. And I learned that both of them have really intriguing pain stories to tell. So, to dive right into the topic, Georgia, can you share how your pain started and how did it evolve?
Yeah, the context of why I'm here talking to you, Tiffany, is I grew up in an athletic environment. I was always a competitive skier from a really, really young age. And throughout my years of competition, as most athletes, had a lot of experience with a lot of different types of injuries. But one that stuck with me through over a decade of skiing was this kind of meandering back injury that always was evolving and changing. And in the early years, was very much talked about by physios as like, sticky SI joints or just like general muscular imbalance and things that we could train out or like manual therapy. And it wasn't really until I was in the end segment of my skiing career where I was skiing for the University of Alaska on the NCAA circuit. And in those 4 years, my experience of pain and my experience with my back injury just rapidly evolved. And it honestly went from a point of just this like naggy, achy back that would kind of come and go to this one day that I was training. And it was actually the start of my last year of college. And was doing my usual every day. I was skiing giant slalom out at our home training hill, Alyeska, and truly between two turns, nothing crazy happened, no fall happened, but my back completely seized up on me. And it felt like the wind was just taken out of me, and my knees just couldn't hold me up. And I ended up just laying on the snow until one of my coaches could hike up the hill and come check in on me. And that was kind of the catalyst moment for me of when this back injury really transformed into honestly like a pretty life-changing event. And not to say that something in that very moment can I pinpoint did like a physiological change happen, but what I can understand now is it was this rapid onset of this really, really intense pain that I had never experienced before. And so from like that point, it was straight to my physios who were working like around the clock to get my back to relax, calm down. From what they could tell, pretty much everything was just in spasm from like my chest down just past my hips. I couldn't even touch my own knees. Like I was sleeping on my living room floor with my knees up at night, kind of management. So that was like first line of intervention with my physios, trying to manage the way that we had in the past. And it got to the point on one of my first weekends after the onset that I was in so much excruciating pain. I took myself to the emergency room in Anchorage. And what I now understand is what happened is that the emerge doctor put me through the red flag screenings, deemed those negative, and honestly didn't do any further assessment and prescribed me some really strong opioids and muscle relaxants and sent me on my way. And the crazy experience in that is I now, as a physio student, can understand that the sadness is like that is the scope of, I think, what the toolkit is of that emerged doc in that moment. But the lack of education for me in my back experience and my back pain kind of started there because he saw this like young female, a pretty obvious reason as to why I had this back pain onset. And when he prescribed me these opioids, he didn't even explain what the opioids were or how they were supposed to help my pain. He honestly told me, don't tell anyone you have these because they'll break into your house for them. And maybe that's a story for another time or a topic for another time. But so my next stage of intervention, because that got me nowhere, was my athletic team in Alaska got me set up with a spine specialist based out of Anchorage. And so I was in his office next Monday morning. We did our MRIs and, x-rays, pretty much everything under the sun that you needed, and had those results back really fast, thankfully. Again, being in the American healthcare system has its benefits in some ways. And when those results came back, it was sitting down with this spine surgeon, and he explained to me that, there was a lot of reasons for why I was experiencing the pain I was experiencing. I had disc herniation from L3 down to L5. I had some bony abnormality that I've probably had as a congenital thing that may have been a contributing factor as to like why I had disproportionate effect on my discs at this point. But the really big thing was that he pointed out that I had an annular tear at L4. And in that moment, he actually like brought up the MRI, circled it on the screen, showed me what it looks like when you actually tear one of your spinal discs, which was a pretty like earth-shattering moment in that injury process because he quickly explained to me that they can't repair and can't heal. And he sat there and he knew that I was a high-level athlete. And his explanation to me, or patient education, whatever you want to call it, was he said, I hope you're comfortable with the idea of being a picnic parent, insinuating this idea that the level of athletics that I was currently competing at was just simply not sustainable. And not even that, but that the level of recreational lifestyle that I like to live probably was going to be problematic for me because of the damage that I had caused to my back. And basically, in terms of solution, he said, this is something that you've done. It's done. It's not going to get better. It'll probably degenerate faster than a normal disc will degenerate. And there's not much we can do for intervention until it's degenerated to the point that surgical intervention makes sense. And we could, in the future, if you have significant arthritis, we can fuse. And I was like, holy. And so in probably a 30-minute appointment, I was on my way. And this was also coming in a time where I was in what also I now know was my last competitive season as a skier. And for a multitude of reasons, but one, I was graduating that year, but also two, my body just like couldn't sustain any more competition. So I was also transitioning out of this world of being a high level athlete with all these like medical teams surrounding me. And I was kind of launching into the world of how the heck do you manage a complex injury on your own? And that's kind of where the story starts. And it has been progressing for me. That was in the start of 2021. So it's been a couple years now that I've been learning how to manage and work with my injuries. But that's kind of like the launch off point of why my story brings me here today.
Mm-hmm. Thank you for sharing that. It's very organized. We will get into the details of what happened between 2021 and 2025, and that's also the very fascinating part, I'm sure. So, off to you, Jules. Tell your story.
Okay. So, first of all, thank you, Georgia, for sharing your story. I know that for me personally, sharing my story always kind of brings forth emotions that have been pushed down or that I feel like I've moved forward from. So, I just want to thank you for being here today and sharing that. That's a lot. So, for me, my pain started in the summer of 2021. And it's kind of a unique onset of pain. So originally, I got a really bad bout of COVID. And with this COVID, I was out from work for like a couple of months. And this was kind of when COVID was just starting to become more regulated in terms of the restrictions and mask wearing and vaccines. So as like a younger girl working, I still wanted to make money. So I was trying to force myself to go to work and push myself through the fatigue I was feeling. But it hit me like a truck. I was extremely fatigued. I had really intense headaches. I remember trying to go to work and it feeling like someone was genuinely pulling my eyelids closed like a blind. And it honestly just felt like my nervous system was completely overactivated all the time. So my work and social life became really withdrawn, and I started sleeping a lot and not going out a lot or talking to many people. And I just honestly felt confused why this was happening because I thought I was just sick and I didn't see anywhere that this could move forward to being worse. I was like, why am I not getting better? So eventually, the actual COVID symptoms surpassed. The fatigue did not. And over the next 3 months, I developed a really severe suboccipital pain, and it was a lot of tension down at the base of my neck. And I figured that that might be contributing to why I might be feeling so tired or fatigued. And so I started doing some self-massaging and tennis ball releasing to try and release the tension. And when I would release the tension, I would feel like awake for about 5 minutes. And I was like, wow, I feel so alive. Like I have energy. And I was like, this is so cool. But it was always so temporary. And basically, from 3 months past the onset of my COVID to fast forward 3 years, I was self-managing with tennis ball releasing, and it just progressively got worse and worse and worse over the 3 years. So the suboccipital tension turned into full-blown neck pain. The stiffness was probably the worst part, like just feeling completely rigid and locked up in my neck. It was completely debilitating. It affected every domain of my life, as I'm sure Georgia can relate. And I tried all the different modalities. I tried going to massage, I went to physio, saw multiple different physios, I saw multiple different chiros, and all of them just gave me some temporary relief, maximum 24 hours. I actually eventually stopped doing a lot of exercise because the exercise exacerbated my symptoms. I was usually quite active and went to the gym a lot, but I found that going to the gym just put me out for like 72 hours. Like whether it was fatigue or pain in my neck or tension and stiffness. Like if I did an upper body day, I could have been out for like 72 hours. And with being in my undergrad and, being someone that's pretty social naturally, that was really challenging for me. And I'd started to develop super bad anxiety around my neck pain, and my neck pain kind of developed a narrative in my life. And it was like this own domain of my life, and it was big. And yeah, I just developed a lot of self-preservation techniques that did not lead to self-preservation. I withdrew socially. I stopped going out with my friends because I was scared I was going to get neck pain or a headache when I was out. I was scared I wasn't going to be the fun friend anymore or be social for people. And so that was really hard for me. I also felt like a bit misunderstood when I would try and tell people the extent to which it was impacting my life, or maybe I did a bad job of explaining that. I felt as though, it was just like, oh, Jules and her neck pain, like, oh, she just has neck pain. She just needs to deal with like that, like roll it out and she'll be okay. But it was impacting me a lot more than that. So honestly, I kind of just developed this reality of acceptance of I have neck pain. Jules has her neck pain, this narrative. And I just accepted that as my reality. And I just continued to manage with temporary relief mechanisms. And I felt really alone and scared as to how this was going to progress as I aged and if there was ever going to be a solution to it. So then, moving forward to more recently, the summer of 2024, I was going to go to physio school. And this just so happened to coincide with one of the lowest points in my life, which was really hard because physiotherapy school has always been something I've wanted to do and felt really passionate about. So having it kind of go at the same time as just feeling very depressed and in pain and fatigued, I was so scared I wasn't going to be able to help patients the way that I wanted to because of the state that I was in. And that was my biggest fear going into it. So, yeah, the first 6 months of physiotherapy school for me were really awful, really, really hard. Like I mentioned in the beginning, I'm not from Alberta, so it also included a component of moving to a new province. And I think the combination of having to develop a new social circle, just like the fears and anxieties around that, as well as living alone for the first time, as well as being busier than I ever had been with school before, all those things combined with chronic pain suppression just completely blew me up in a way that I had never experienced before with my pain. It felt like my whole body was completely inflamed and my nervous system was in overdrive 24/7. I would come home from class every day and collapse onto my bed with a headache and think like I cannot bear this pain right now. It is so bad. So I actually considered taking leave from the program and I talked to my program supervisor about it. They were super supportive, which was really, really nice. But ultimately, we just decided, let's try one more month. Let's just keep trying one more month. Like, keep putting one foot in front of the other. This happened in conjunction with a lot of other supports like therapy and treatment for my pain, getting the right supports. But the real turning point for me was actually meeting one of the guest instructors at the U of A. His name is Jeff Vela. He's going to have a little feature in this episode. He's a super intelligent physiotherapist in Edmonton, and he was teaching us on how to observe lifting. So it was actually very interesting because the first time I met him, I was doing a lift just in my own corner with my friends, and he comes over to me and he's like pointing out these deficits, and he's like, hey, like, guys, come look at this, right? And he's like, show and tell, like, come look. And he pulls me up on stage. He's like, I just want to show you guys how Jules is compensating here, okay? And everyone's like, oh, wow, interesting. And so I go up to him later and I'm like, hey, I actually have life-altering pain. Do you think that this is related? And he was like, almost definitely, yes. And just in that moment, I remember for the first time in like 3 years feeling this like glimmer of like, oh my God, there is a mechanical cause. I can fix this. Because as we'll get into later in this episode, George and I had been through multiple different healthcare professionals and like no one had addressed this for me at all. And we'll talk about that later. But it just gave me that glimmer of like, wow, okay, someone sees that there's something wrong for me. This pain isn't made up and potentially we can fix it. And it was also very cool that just through observation, he was able to detect that. So I actually just followed up with him on email after, thanking him, being like, hey, I really appreciate your knowledge that you shared with us and your willingness to like observe my movements and communicate that with me. That meant a lot to me. And we kind of formed a bit of a relationship online. He shared, that he was willing to treat me for free if I needed to, if I still didn't find success with the current physios I was working with, which was like a huge, huge weight off my shoulders. I felt like that was, you don't meet people every day that offer free treatments to complex cases, people that are already busy. Like, that's special. So I continued to work with my physio I was working with until I got to a point where I was like, I need someone else. Like, I wanted to give the physio I was with the benefit of the doubt for everything. And I wanted to let him try and problem solve. But at the end of the day, I was like, no, I need to do this for myself. So then I reached out to Jeff and I was like, I would love to book an appointment with you. And then from that point forward of meeting Jeff and working with him, my life has completely changed in the last year. And it's been a very incredible journey. And I think we're going to get into that more in this episode. But that is my story up until now, leaving out the last year of rehab.
When you shared how this pain shaped the narrative you have about yourself, that no, just got into my heart. Um, Georgia, do you have something like that? Like, how did pain shape how you see yourself?
It's funny you say that, Tiffany, because I was gonna jump in and just say, my God, I love how you frame that. I hate that it's so right, but I love the way that you frame that because developing this narrative around pain and the way that the pain presents in your life and what that means about you as a person is like I think it's an experience that's really, really hard to explain to someone until it happens to you. And for better or for worse, like we have that now. And I hope that that is a piece of the information we get to carry forward as providers. But it, at least for me, and I think very similar to you, Jules, it stripped me of my identity for all intents and purposes in many ways where I went from the highest high of like being, especially in physical fitness form of a high level athlete, to one being like stripped of the ability to do that. And even though I was probably a little silly and competed through a lot of the initial pain that I was in and like could get my boots on barely in the morning and like get out there and like show up in the day, like it wasn't me on that hill. And like same thing, like for the first year and a half after like that initial MRI appointment, I socially withdrew in so many ways and like didn't really understand how deep anxiety can run and how much fear can control the decisions that you make and just how much drain it has on you. It just kind of sucks you dry. And so, if anything, your narrative just kind of becomes this like meh,
Yeah,
like frick.
no, it really does. And the crappy thing about it is other people see it too. And anyone that was close to me knew about my neck pain because it was a constant in my life. Like I would have to remove myself because I had headaches. I would have to remove myself to go release my neck. And I remember living with my roommates and I'd be on the ground tennis rolling my neck and they'd be like, "What are you even doing?" And I'm like, "I don't even know. I'm just trying to survive."
Don't worry about it.
Like
Yeah.
yeah, and so it honestly really does become its own story and narrative, and it's completely attached to your identity.
Yeah, and it's hard to untangle from it. And it sounds like you've had a really incredible healing journey since figuring out some information. But honestly, even now, I've come a really long ways in learning a lot about my body, but also my mind and learning about pain science and different management techniques and everything. But even that said, like if I'm being fully, fully reflective, like I still feel like a much more fragile version of myself, where a lot of my personality, a lot of like who I am is drawn from the things I do and like my willingness to just jump into unknown situations. And I just like love that stuff. And now I actually have fear doing a lot of that stuff. And so it's still really hard to untwine. And even in my physio classes now, I'm like, oh, whoever's doing PNFs on Georgia, be careful. Her hips are crazy. Yep,
Yeah,
careful with Georgia. You don't want to do that. You'll piss her back off. Don't look at her sideways. Her back might flare.
that is so relatable, Georgia, because you're in your general MSK block or your first MSK course. And I remember last year when I was in that block as well. Every time we do strength testing or RI on the upper body, I was like, oh no, like we have to do my right side because my left side's flaring right now. And it was crazy because if someone even touched or did RI on that side, my whole day would be ruined.
Yeah.
So I can totally relate to that. Like I feel like everyone's like, oh no, we can't do Jules's left side. Like
Yeah. You just kind of become this like ticking time bomb.
it really is. Yeah.
It sucks. It
And it
does.
also, like, I'm laughing about it, but it actually sucks. You kind of just feel like, even though you're not a burden, it almost feels similar, or you feel less. I don't know quite how to put the words to it, but it's not a good feeling, basically.
No, no, definitely isn't.
So both of you kind of have come over to the other side and have this hindsight to look back at the whole pain story. But while you both are in it, the depths of it, and having this pain really shape the way you live life and how you see yourself and how others see you. Did you have a way to make sense of your pain? How did you understand why you're in pain back then?
Maybe I could jump in on part B of my pain experience. And what's being unraveled here is that Jules and I are coming from two very different points. There's a lot of nuance, but in a very, very simplified version. It's like I came from a world of every single provider I saw could point 10 fingers at the reasons for why I was experiencing the enormous amount of pain I was. There was a lot of evidence mechanically why I would be in that pain. But what was really missing was an explanation as to like why I got there, why I got to that point, why my back was seemingly as fragile as it was, and why it was imploding on me. And so I was left with this big lump of information about my body, all of it really scary. I knew my lived experience at that time where truly I couldn't touch my own knees and I have pretty long arms, guys. It was wild. And I was like, okay, what do I do with this now? How does someone even move forward? Because it's not like they weren't like, oh, you have a tear, or you have a broken bone, or like there was no definitive prognosis or honestly diagnosis really at that point. So kind of moving through that initial phase was just this massive onset of fear and this fear of like one, I was never gonna get over this. Like I was gonna be in this amount of pain forever. And two, fear of further injury because there was no understanding for me as to why these things were happening to me in the first place. It was like, well, if I like turn too fast, is the rest of my disc gonna tear in half? And like, I don't know. Like, I didn't have the information that I'm learning now in physio school. So I just had this like honestly internalized fear mongering of myself of like, well, Georgia, you have to be careful, otherwise you're just going to make it way worse and think about how bad it is now. And so like my initial onset was, okay, we need to deal with these injuries. How do we do that? So I started reaching out to every single pain clinic that I could think of. And I was also in the transition between going from American healthcare back to Canadian healthcare, which is also really tricky. And thankfully, I got into a pain clinic that's here in Calgary. And the doctor that I saw there recommended that we do some pretty aggressive PRP injections, which stands for platelet rich plasma, into my back. And it's this process that is still deemed very experimental in Canada. But basically, they draw your blood, they put them into these spinning machines that spins your blood until all the layers separate, and then they can take this, they like to call it liquid gold, this little thin layer of your really rich platelets. They suck that out, and then they put it into a big injection needle and they send it into wherever it is you need. The idea behind it, and again, this is a very simplified explanation of it, but how I was made to understand it at the time is when you have injury in areas of your body that the body has a hard time responding to, or if the inflammation response to that area has been so prolonged. So, like for me, my back had been in this like chronic inflammation state that it couldn't break the cycle and it like would not stop. And that was driving the pain and all the things. So, he's like, basically, if we send this into your back, it's going to cause this massive inflammatory response. And it's really going to suck for probably a couple of weeks because you're already in such a heightened inflammatory state. But the idea is that it will break the cycle and it will right your body and your brain to say, okay, so we're sending inflammation there right now, right in the short term acute way that it's supposed to. And then afterwards, done, and we can start the healing. And I will say after those injections, I went into a massive inflammatory state and I didn't think my pain could get any worse. And it absolutely did. And I spent about 3 weeks lying on hard surfaces, like cursing my own name for doing that. And like, what the heck was I doing? So, like, that was one bucket. I was doing what I could think of from like more of the physiological, like tissue healing perspective of like, let's just make this as good as it can be, even though it won't be perfect. And then the secondary bucket of that, and two really important catalysts to this was one, on that topic of like narrative. I was actually, after living in Alaska, I was living in Salt Lake City for the year after university. And one of my friends there, she has an autoimmune disorder that really attacks her joints. And if anyone knows chronic pain, she knows chronic pain. And up until this point, I thought the definition of chronic pain was like your aging parents that have progressive osteoarthritis and like a non-relieving mechanical pain. Like that's what I thought chronic pain was. And I didn't understand these ideas of complex pain. I'd never had a provider one time say, hey, Georgia, what your tissues are experiencing and what your mind and body are experiencing are two separate systems. And of course, they're interconnected, but you have to be able to understand and treat both systems. Like that had never been introduced to me. And then the first friend that has the chronic pain, I was explaining my back situation to her one night at like a social gathering. She's like, so you have chronic pain? And I was like, what? I was like, no, like I just have this like really crappy back injury and I don't know, I might be like this forever. And that's actually, she's like, so you have chronic pain. And I was like, what? And it just like kind of rocked me. And I was like, I don't even know what you're talking about. And it was probably not within 2 weeks that this completely separate other friend that also knew what was going on with me reached out and was like, hey, I had this really nagging long-term injury in my foot that I just like couldn't deal with. And I found this really cool app and it is called Curable. And it basically introduced me to this idea of like how to psychologically deal with your pain and how to manage it and how to treat it. And he was like, I really think that you should just like peek into it, see what's going on. And turns out this app Curable is basically developed by interprofessional team of neuroscientists, psychologists, different types of specialists in the area. And the idea is it's an educational platform, and then it's also like a psychological platform of building up a toolkit of how to treat pain separate from the actual tissue healing MSK interventions that we're doing. And honestly, when I first got onto it, I was pretty mad and I was pretty sensitive to the idea. And I was like, not at the friend necessarily, but as I was working through this, I went into it with an open idea of like, okay, what is this business about pain? But as I was working through even the first couple modules on it, I was trying to explain how pain sources from the brain and it's in response to mechanical injury, but there's all these different systems. And like, it really just broke down like why pain is separate from what we now call like nociceptive pain or like the true mechanical reason for that pain. And I was so, so sensitive to that idea and was like, how dare you strip me of my experience? No, I was like, I've seen the images. I have a blown up back. Like, this sucks. I'm totally screwed. And there's every reason why I'm in this much pain. It's not because it's in my head. And it was from a very, very patient partner who continued to push me to just like keep an open mind and work through it. And it took me quite a while, but approaching it from an educational perspective and less from like my own personal perspective of like, is this me? But I was like, okay, let's learn about this pain science business. That was my very first intro to like this idea of pain science and why pain could be coming from different inputs, not just the physiological input. And that was a huge game changer for me. And I want to hear more from Jules, but if there's time, we can get into even some of the very first initial tools that this app gave me is what honestly blew my mind and has changed my perspective of the experience of pain.
Before we jump into Jules' perspective, after you've encountered the curable and have worked through some of the modules, what is your summary statement at that time, as in why you have or why you experience this excruciating pain?
The summary statement is that it's not a binary experience. And where I didn't understand or identify the signs in myself when my pain was turning into a complex pain, I couldn't understand at the time that there were more inputs than just one to my experience of that pain. And now I understand that there's a magnitude of inputs. And I think very rarely can you ever riddle it down. Like the magnitude, the length, duration, frequency, like any of these different aspects of like how people experience pain, I think is very, very rarely all because of like one input. And I think the cynical person would say, so you're saying it's made up in your mind. My perspective on it now is, well, no, it could be driven by your body, but your mind is what determines what to do with that information. And then when you think of all the things that impact your mind and how your mind can adapt and handle information, you just open up this equation to like infinite possibilities. And so for me, I was able to identify that my greatest inputs outside of the physiological side were the development of fear, anxiety, and honestly, an outcome was probably more depression, but I think fear and anxiety became like just as much, if not bigger, drivers of my pain experience than the actual like mechanical injury was at the time.
Mm-hmm. Yeah, Jules, go ahead, like speak to your experience. Does the term complex pain resonate with you at the time? How do you understand your pain?
I just want to note really quick that with Georgia's story, it's shocking to me and concerning that there isn't education on the difference between chronic pain and acute pain. In part why I joined this podcast, and in part why that's going to be my topic for a later podcast. You should watch that also. But that's crazy to me because chronic pain is so different than acute pain, and there are physiological changes in the brain matter that happen with chronic pain. Like your brain will remap itself in response to chronic exposure to pain and becomes hypersensitive to pain stimuli. And that is huge. So when people feel as though, maybe the pain is made up and it's in my mind, it's like your pain isn't made up, but it's the source is potentially coming from your mind. And that doesn't mean that it's not real. It just means we need to change the target at which we're treating. I think that if that's laid out for someone like ABC, the fear and anxiety that could explode from a chronic pain situation would be significantly decreased. This education is so basic and straightforward, and I just am shocked that, someone like you who has access to really good physiotherapists, like complex healthcare professional team with your ski team, it's just shocking that there wasn't that education piece for you because I'm sure that would have significantly changed the way in which you progressed with your pain. On that note, for me, how I made sense of my pain was very different. So I actually, because I obviously saw many different healthcare professionals, and eventually I started to believe them because they were telling me it was made up. And yeah, it was wild. So everyone that I went and saw talked to me about managing my stress and the role that depression plays on pain and how to cope with that and the role of catastrophizing. So I got a lot of that education, which was very different from Georgia. And it was really, really frustrating for me because 100% there is a neuropathic component to my pain, no doubt. And there is definitely a role of depression and fear. But I felt to my core a mechanical problem driving this. Like I was a very healthy child, very active. There's no way that I just wake up at the ripe age of 21 and I'm in chronic pain for the rest of my life for no reason. And so it was super frustrating to hear repeatedly over and over and over again, just manage your stress. It seems like you're not managing it well. This is the difference between nociceptive and neuropathic pain and what might be happening for you. And I'm like, yeah, I hear you. Like, know your audience. I am a physio student. I know that as well. I'm coming to you for help past that because I feel like there's something else going on. And I slowly started to form a narrative for myself that was like, I'm making this up. Like, I'm making this worse than it is. And as a kid, I was always a highly anxious individual. So I was like, wow, my anxiety is really just perpetuating this. And I'm really just blowing up my life. Like, how am I supposed to stop this? And so that was also really jarring and really hard for me to mentally understand and not feel fearful about because I'm like, oh my God, I'm gonna continue to get older and continue to have these anxieties and just perpetuate the issue. And if there's nothing mechanically that I can fix, what am I to do? So that was a really scary and totally different experience than Georgia. But that was kind of my experience with how I made sense of my pain.
It's a very interesting contrast to hear the difference in the role of pain education, how that played into both of your stories. But one might ask, where do we draw the line between understanding the contribution of fear and anxiety and stress in pain and needing to also manage your fear and anxiety and stress, and when and which.
Yeah, I hear you, and I know exactly what you're talking about. I think the important piece is recognizing that it is the two that work together, and you're never going to just have one without the other. I mean, there are obviously like scenarios of allodynia, which is different, but for a majority of the population coming to you who have had chronic pain, there will be both pieces of the picture that you need to address. And it's like the mechanical deficit of which is driving the chronic pain in the first place to now the brain that's driving the chronic pain even further. Like, what was the acute source? Now it's translated to chronic. Let's address both and education on both. I think that if that is your goal right from the start with your patient and education on that, then you are going to be saving them a lot of hoops to jump through and a lot of fear and anxiety moving forward.
I would agree on that. And I think that it's important to note that, of course, there are the outlier cases of pure neuropathic or like nociplastic pain. And there's so much work and research to be done in those areas to really help the patient experience and management of those conditions. And it's hard to say because it's like, even in your case, Jules, I'm so glad for you that you found the person who is willing to go the distance and figure out that really tricky piece of the puzzle and find that mechanical driver so that you could have both prongs, both sides of the approach of that treatment. And that is what has created success for you versus like mine was like such a clear mechanical driver that everyone was fixated on that and everyone forgot about the other part. And I just honestly count myself lucky that I stumbled upon by myself the right tools to be able to find that second side of the treatment for myself. But where it gets really tricky is when it's stumping. Like there are cases when you might run out of tests to do. You might run out of places to look for a mechanical driver. And you have this patient sitting in front of you. And like, I hate to think about the outcome of you not having like your stars align with Jeff and having the person that sees the one thing that makes the world of the difference for you. And so that's where I am so stumped and why I am so intrigued about this area of work and like finding the balance because if you don't have the education on pain science, you're completely neglecting one entire half of the treatment, in my opinion. But if you see pain science and causes of complex pain, like all these different variations of what might drive complex pain, and you can't find a mechanical driver for it, it's really easy to hang your hat on those and say, well, it has to be one of these because we can't find a mechanical driver. And that's not necessarily a better health outcome for that patient and might actually just make them upset and quite
Hmm.
frankly, like piss them off and make them feel like a little belittled in their experience. And so it's this like incredible evolution of our approach to care in understanding that there are many different sides of treatment and a lot of it is from like the literal structures of our brain and then like the psychological components that can change that. But it's also, okay, now we've figured this out. How do we now find this balance? How do we improve how we're educating based on it? How do we self-check ourselves as providers to be like, hey, I'm going too far down one pathway. I'm 100% saying that this pain is experienced because it's just complex and it's fully neuro and there's no other reason. And it's just like, I don't know what the answer is there, but that's where I get really stumped in this equation.
Let me jump in with an analogy that some of you in the audience may have heard. In pain education, we sometimes use the image of fire and smoke in a room. Imagine a room with a fire and there is an excessive amount of smoke. So much that your vision is clouded, making the job of extinguishing the fire really difficult. In this analogy, this excessive amount of smoke represents a complex pain presentation. Things that contribute to the smoke response are like heightened sensitivity, a lot of fear, stress, protective responses, etc. Sometimes we need to deal with the smoke first. Calming the pain presentation can make it possible to see the fire more clearly and help the patient more meaningfully engage with treatment. But Addressing the smoke doesn't mean we should ignore what is generating it. The fire, depending on the patient, could be an ongoing biomedical issue, or it could reflect a sensitized nervous system or a persistent threat response that continues after the original injury has healed, etc. Effective care requires us to address both, reducing the factors that amplify the smoke while also identifying and managing the underlying fire that continues to drive the smoke in many cases.
Yeah, I
Yeah,
completely.
I really, really like that analogy. Sorry, Georgia.
No, it's all good. I was also going to say, I think it's spot on, and maybe to help ground it in an experience for someone who might be more new to the idea of pain science and how does this all fit into a lived experience, especially I think in my case where there was such a clear mechanical driver of pain, it was really, really important in my healing process to have the level of diagnostics that I had and to have the imaging results that I had. I couldn't have made progress in a lot of ways without that information. And a big reason for that was because on the other side of things, I'm over here absolutely freaked out and so scared that like if I sneezed, my back would collapse and I would just like cease to exist. Like the catastrophizing was at a scale of 10,000 plus. But because we had all of the diagnostics on the physiological side, the pain doctor I saw here in Calgary was the first person since that spine doctor had scared the living daylights out of me. This pain doctor in Calgary was the first one to look at me and say, Georgia, compression of your back is good. Compression of your discs is how we keep them healthy. You have to keep doing things that cause continual compression. Like for sure, as you heal, as we rebuild muscle balance and strength, we need to be, stay within pain's limits and all these things. But like when I looked at him in the eyes and like the scariest thing that I could ever do was be like, will I ever ski again? And not even compete, but like, will I ever be able to put skis on my feet again? And he was like, well, yeah. And I was like, what do you mean? Well, yeah. And he's like, no, like maybe don't go huck a backflip off a cliff right now, but like going and skiing and continually recreating in those ways is going to keep your spine healthier longer, even though you have this level of damage, whatever it is. And understanding that physiological component was so key to me for the psychological component to start to heal. And like the secondary part of kind of grounding the conversation and like what this might look like. So this might sound ridiculous, and this might be evidence for the people that might be cynical of different approaches. But when I found that app that originally helped me learn about pain science, and the very, very first part was just explaining what pain is and where it comes from, how neurotransmitters work, like the literal neuroscience behind how our bodies function in that way. And then some of the very, very first tools that helped me were tools that helped me redirect those neuro pathways that I had been burning in. So, because I was so scared of the pain that I was experiencing, I now recognize that I was causing myself pain before there was any physical driver from the injury to have the pain, if that makes sense. Like, before I would move, I would brace to move, expecting that pain to onset in different movements. And I bet you if you were to track my brain activity, I probably would have experienced the pain in my brain before that tissue in my back had ever flexed like a millimeter, Like I was expecting the pain in such a way that in my mind there wasn't an option to live without that pain. And a big component of that I didn't understand at the time was that narrative piece of like I am incredibly lucky to have a very, very loving and caring partner who was by my side and was taking care of me in this time of like I was in a soft-sided supportive back brace. I'm sleeping on the floor like I was just not me. And she would ask me constantly, how's your back? How's your back? How's your back? And always checking in because she's so worried about me. And even though it comes from such a good place. And she was one of many people in my life that were worried about me and knew about this pain, asking, "How's your back? How's your back?" And before I knew it, like I was like, well, the pain is pretty bad today. The pain's mild today. The pain is, and I'm associating like literal the word of pain with my back, this idea of my back. And when I closed my eyes, I would just picture that torn disc. And that's the image I had of my back, of this like fragile thing. And one of the tools that's, this sounds so silly, I can't believe I'm saying this in a public space, but it recommended that I rename my pain to literally get rid of the word pain. Like it's such a triggering word. And so we renamed my back pain bananas. And I might regret saying this.
No regrets. I love that.
No regrets. And so in the day, my partner could say, "How's your bananas?" And I could say, they're pretty ripe. They're okay today. They're a little ripe, but some days I'd be like, the bananas are rotten. They're so rotten. They're stinking up the room. They're so rotten. And like it had the effect of one, it always gave us a good laugh. And it just kind of brought my whole like heightened experience around describing my physical experience down. And I was taking away the association of, we called it the P word. No one was allowed to say pain in the house for a little while. It's tools as simple as that. Like, I can't go back and track exactly what contribution that had to my healing process. But what I can say is, in that time period that I started putting some of these tools into practice, it really helped my lived experience and started to help reshape that narrative, that really critical narrative of like, I'm not just walking around talking about my pain every day. I can make a joke about my bananas and then I can move on because the whole room doesn't go quiet when I talk about my horrific back pain. If I say something about my bananas, everyone has a good laugh and we move on and we talk about other things. It was a really, really critical changing point for me.
That is very, very interesting. And I'm really glad you shared that actually, because I've never tried that. And maybe I should.
Those pesky bananas, I tell you.
I love that.
Offline, I'll tell you all the other ones
Okay,
that are even more ridiculous.
sounds great.
That was very helpful. Thank you for grounding this conversation in a real life, real story. Now, to you, Jules, this app Curable really changed and transformed Georgia's story. What was the thing that transformed yours?
So I did mention how I met Jeff. That was the turning point for me for sure. And I had gone to see numerous healthcare professionals, PTs for my issue. And when I was recounting my interactions with them, I realized that there was probably one out of 20 that did a movement screen and range of motion observation, which is absolutely bizarre to me. So when I went to saw Jeff, this kind of leads into my story with Jeff. He did the most thorough subjective history I have ever gotten done anywhere. He asked me questions all the way back to when I was a kid and injuries I had when I was a kid and how they affected me. We did an extremely thorough movement screen slash range of motion analysis. He looked at my cervical range of motion, my thoracic range of motion, side flexion, flexion, extension, kind of everything under the sun. I don't think we did necessarily a ton of strength testing because I was already in pain without resistance and he didn't want to cause any flares. But yeah, so he did a super thorough range of motion, palpation, just observation. Then he sat me down after and brought out a skeleton and told me the entire picture of my story. And he did tell me, he's like, since I know you're in physio, I'm going to make this more complex than it usually would be. But the education was just immaculate and it made me feel so validated. Basically, what he said was what he could make sense of. Like, we don't know for sure, but this is what we could make sense of with the information that we have is that after COVID, the virus potentially attacked the synovial cells in my spine, causing synovitis. So, for anyone listening that doesn't know, synovial cells are a cell that secretes synovial fluid, which is a lubricant. So, they are basically allowing your joints to move smoothly between each other. And what triggers the release of the synovial fluid from the synovial cells is movement. So if you are not moving through a certain part of your body, the synovial cells are not going to be stimulated to release the fluid. So therefore, you're just going to get this progressive stiffness and hypomobility going on. So he thinks that I got some synovitis in my spine and developed hypomobility. And because now my spine, thoracic and C-spine weren't moving properly, that you're no longer now going to be able to recruit the correct musculature with movements. So the example he gave me is like, in order to have the traps recruited properly, you have to have full extension in your T-spine from T1 to T8. Because I was lacking extension, my traps were not active in the way that they should be. So what happened is, to make up for the lack of thoracic extension, I was using cervical flexion and protraction, which inevitably put strain on my suboccipital muscles and my levator scapula, which explains a lot of the tension I was getting in that area. And then if you're not using the muscles, they're just progressively going to get weaker. So it was this one perpetuating cycle of like, okay, virus attacks cells, cells don't secrete synovial fluid, hypomobility of the spine, muscles aren't able to contract the way they should. Compensations are happening in the cervical spine that are causing hypertonicity of those muscles, and the muscles in the thoracic spine continue to weaken. And that progressing over 3 years explains why it didn't get better. It just continued to get worse. It wasn't like a scenario where, oh, let it cool down and let it heal and it'll get better. It was like, no, it would have just kept getting worse if I didn't see Jeff. Yeah, so that was so cool to me. I had never had any explanation like that given to me before. I thought that, we don't know if it was the synovial cells that were affected, but I'm going to take that and I'm going to run with it because that makes sense to me and what I feel. And then basically, when I worked with Jeff, the target for my exercises was working on thoracic extension, controlling cervical flexion while you're doing thoracic extension, and trap engagement, which sounds so black and white, okay? These exercises that I got from Jeff were, I don't know how he came up with them. They were so cool and unique and innovative, and like, so much mental cueing goes into them. Like, 1 rep of these exercises is like a 1 rep max on a squat for me. Okay, it's taking like a ton of mental effort. And in part because the neurological connection between my mind and my muscles in my scapular thoracic region was so poor because there wasn't that connection going on at all. Those muscles were not contracting for like 3 years properly. So I had to build back that mind muscle connection. I remember trying to do a shoulder shrug for the first time and being like grimacing, and there was like unweighted. It is crazy because yeah. So anyways, I have like a whole host of exercises that we did together, but I won't go into all of them unless we have time at the end. But just know that the thoracic extensions and controlling for cervical flexion, as well as trap engagement, is a much more complex treatment than it sounds. Like, it sounds like, oh, just do your mobility. Like, no, it was very intense and very mentally draining and straining. And Jeff warned me that my pain would get worse before it got better because these joints that had not been moving in 3 years are now going to start moving, and it's going to be extremely painful. And he was right, and my headaches blew up. And they blew up for months and months and months, and I kept going back, and it was months and months and months, and we'd progress, and I was trying to battle through school while having these awful headaches, and yeah, it ended up all being worth it, but it was quite the journey.
So we have the Jeff Vela joining us in this conversation now. I wanted to invite him to our conversation to see his perspective on his treatment process with Jules. So, Jeff, picking up from what Jules described, I want to hear from you. What was your thought process and your approach with Jules? What initially inspired you to take her on as a client? And after you did the detailed movement assessment, how did you know where to go from there?
Yeah, I mean, initially taking Jules on as a client was essentially multifactorial. I had heard her story from her firsthand in a classroom at the U of A. And a lot of my motivation to take her on as a client was from an empathetic lens and just hearing her story of where she's been and the struggles that she's had. Selfishly, taking her on as a client was also interesting for me because I like working with complex cases. I like working with folks who have had minimal success or spun their tires or hit walls in terms of their recovery. And it was a good opportunity to reach out to Jules and see if we could make some changes. When it came time to doing the assessment, as Jules mentioned, we did a thorough subjective exam, and her story was remarkable from start to finish. She had a lot of good intel. Sometimes I think folks that we work with in the clinic are poor historians, and Jules is a great historian. She's got a good read on what's important and what her story has, how it's all unfolded for her. So it was helpful to hear her share her story. And then from the objective exam, obviously we're talking about chronic pain here, but I do tend to take a stance of not necessarily letting pain guide my assessment, which I think might be a little bit different, where oftentimes we're using special tests, and is there pain, it's positive. Is there not pain, it's negative. And I think that can, especially in terms of chronic pain, can lead us down a slippery slope, potentially not give us the best information. So with Jules' assessment, really appreciating her pain and trying to understand where it's coming from, of course, but just taking a look at her from a blank slate standpoint and getting a sense of what could be contributing factors was really the motivation for how I approached the assessment.
In a lot of Jules' previous experiences with other providers, the conclusion was jumped really quickly to her experiencing chronic pain or complex pain that has a huge psychosocial element to it. How did you not fall into that thinking process?
Yeah, I think for me, I very vividly remember Jules bringing that up in the subjective as well, and her frustration around potentially being lumped into a category that maybe didn't resonate with her. I think the biggest thing for me was it didn't match for me either, though. So even just in the subjective history, this was not the subjective history of someone who's struggling with stress management, and the pain reduction and her symptoms were not associated with purely those yellow flag kind of indicators that we often will see in the chronic pain population. And instead, everything she was describing seemed to get more check marks for things that could be related biomechanically. And of course, we know Jules' brain would change over a long period of time of having pain production. But from my perspective, that doesn't mean that there couldn't be a catalyst there that's biomechanical. So the way I approached the assessment was seeing if there was anything there, and knowing that if there wasn't, I was going to have the hard conversation with Jules and be in the camp that she didn't want to hear what I had to say, potentially of the same kind of rhetoric. But a lot of the assessment, I was trying to prove myself wrong. I was like, well, what if this is just chronic pain? What if there's nothing biomechanical here? And which is what I'll often do, is just try to prove myself wrong initially. And I couldn't with Jules. It was glaring and became very clear every step of the assessment.
I really appreciate that. What I'm hearing is that careful listening, really hearing the patient out in the subjective, can often point you into certain directions rather than having your thought and your sort of biases be the glasses you see through in their pain experience, and how you were very meticulous in identifying mechanical and nociceptive contributors to pain, and that was very helpful for her. Now, after you found out the mechanical factors and suggested some of the exercises, which were 1 rep maxes for Jules in her terms, it still took very long for Jules to get better, and in fact she got a lot worse for a long time before she got better. Did you doubt yourself? How did you manage that response?
Yeah, it's a challenging thing when you're working with the spine in particular, and even more so with something that could be under the umbrella term of cervicogenic headaches, where there's so many contributors to it. And a part of those contributors are going to be things that we are intentionally aggravating. So, I think the way that I approached it with Jules, and the way I approach it with a lot of clients that I'll work with, is to be focused on goals that are not pain-based as well. All the conversations with Jules, we weren't really talking about, well, if we do this, then your pain's going to come down. It was almost like a milestone approach of, we really need to see your thoracic spine move better, need you to be able to control it, need you to be able to be strong around it. And for me, I was at no point discouraged, just knowing that if she could get past these milestones, she really would be able to live with fewer and fewer symptoms. And I was encouraged because Jules worked her butt off as well. It was very clear. There's never a moment she came in where I was like, what happened? Where's the change I'm expecting? Why aren't we making the change? Of course, like anyone, there's going to be ups and downs compliance wise. And Jules was always super honest about that. She's like, I didn't really do this one, but I really hammered out these two. And then, yeah, I can expect to see those kind of changes then. So Jules was a hard worker. She was honest about what she was working on, and we could then take the changes she was making and build off of them, which I think was, I can't speak for Jules, of course, but for me, that was the motivator to know we were on the right track because she was making the changes. If the changes weren't made and her pain was flaring, I think I probably would have started to have doubts for sure.
I definitely agree in terms of like the piece of where did the motivation come from. Like, honestly, there wasn't another option because the other option was resorting back to just like living in pain with no solution. So, kind of like I mentioned in the interview before, it's like I took this idea and I ran with it and I went as hard as I possibly could with it because the explanation that made the most sense of everyone I've met with. And after working with Jeff like a few times, I feel like I gained a really good sense of just like, where he was coming from, like who he was, how he wanted to help. And it was just like I felt so much trust in Jeff, and I just wanted to lean into that and work like exactly kind of what he said I should work on. And seeing little bits and pieces of progress functionally was what kept me motivated as well. Like it wasn't necessarily always associated with a decrease in pain, but the functional improvements were huge. And there were also small moments of symptom relieving experiences from the exercises that then built up into like symptom exacerbation. But I could feel my spine start to move again and it relieved like tension on my head. Even if like a week into doing the exercises it would blow up again, I'm like, this is doing the right thing. Whether or not it's like decreasing my pain right now, my body is moving so much better. So it was little wins like that. And on top of the trust that I have in Jeff, and I think the trust comes from not just like blindly trusting someone, but someone who is thoroughly backed by education research, explaining the education behind it to me so I can understand is so motivating. If someone told me I needed to work on thoracic extension and then sent me off with a thoracic extension exercise, I'd be like, I'm not doing this. Thoracic extension, like what even is that? I feel like we don't talk about that a lot. And so the education piece really helped me trust Jeff and like where he was going with it. And that was very motivating.
I'm curious from your side of the experience of having this onset of a chronically developing pain. Takes you a really long time to find the mechanical driver. You find your angel from above who diagnoses it, and you guys have been working on all these great, impactful exercise interventions. What is your experience with pain now? Do you still get like distinctive flare-ups? Do you just have like an overall lesser experience of it on a day-to-day? Like, how does that look for you?
Yeah, that's such a great question. So, initially, when I was finally given a diagnosis, for the lack of better terms, and a solution, a light at the end of the tunnel, I remember the psychological burden came down quite a bit. And it was like that for like 2 to 3 weeks where I was like, wow, this is great. I'm going to get worse before I get better, but it's all going to be okay. And then it didn't get better. And it just was like very intense head pain, fatigue, and headaches while trying to manage physio school. And I remember being like, crap, like this is actually going to take a long time, like he said. And the light is there, but it's not close. And so there was probably a very short period of time where I was very amped and excited. And part of that probably played into why my pain decreased a little bit. But then as I continued to work through the mobility deficits, it was hard.
Yeah. Once you got over that initial hump of the healing process and like that massive spike of pain, like now that you've been down what sounds like to be like a better equalized state for the last little while, do you still get spikes of pain or is it pretty neutral now?
No, I definitely get spikes of pain. And yeah, I still have to work on it daily. So it's honestly just recently, since September, that I've been experiencing more days without pain than with pain. So that's almost a year because I saw Jeff in October last year. So it took almost a year to get to the point of experiencing less pain.
Honestly, for me, and what kind of sounds like for you too, is like because we're cases, even though we've like kind of reverse engineered from two different sides, but we both have these mechanical drivers of pain. We both progressed into these states of differing experiences of complex pain. And then through that, we've learned a lot about pain science and treating from both ends. And for me, the biggest thing is I'm a couple of years out from that massive acute onset, and my body is still like the scariest looking Tetris block you've ever seen in your entire life. Truly, it's like one piece shifts the wrong way, and it feels like the whole thing could come tumbling down sometimes still. Like there's still a lot of work to be done and a lot of learning
Yeah,
to be done about like how to make a more sustained state.
I hear you, and I totally resonate with that. There are times where I am doing great, and then all of a sudden it is awful for a week. And I'm trying to comprehend why that happened or what I did wrong. And I think one of the biggest things I've learned, and I'm sure you've learned too, is that accepting that healing chronic pain is non-linear and it's not going to be linear no matter how much you want it to be or how hard you try. And being okay with moving backwards and not panicking that you're never going to get better when you move backwards. I think that's something that I really struggle with still and communicate to my friends. It's like if I experience a really bad bout, sometimes it can last like 3 weeks and I'm like, I'm going backwards. Like this is I'm going to go back to a place where I was before. And it's like if you're able to control that mental thought and be like, moving backwards is okay. It's a part of the process. It's non-linear, and I will get back to that place of being pain-free, then you are going to be so much better off because it's never going to be linear.
I think that that's honestly the exact point that I was trying to get to of honestly, if there was like any of my own personal, absolutely not science-backed evidence for treating complex pain from both sides, is like honestly, if I was to map from the point of getting over my initial massive hump of healing and like that massive, huge hurdle of pain to getting to like these bouts of somewhat improvement, kind of going back downhill, a little bit of improvement, the fluctuating state. If I was to map across that timeline of like, if I go into a flare, or like what I call a flare is like if I've done something and I just totally piss my back off. And sometimes I do it in ways that like I'll wake up in the morning and I'm like, oh my God, that is not fun. Or it happened to me like last winter skiing for the first time in a long time where like I took a turn and something went in my back and it felt like a really, really hot burning nerve pain. And that used to happen to me a ton at the beginning. And the point of this is like, if I was to map across a timeline, I think the period at which I experience those flare states is getting shorter and shorter. And I think the massive contributing factor to that is because I can psychologically manage myself better now when I have those flare states. And like when I have that moment of I moved the wrong way for whatever reason, I just did the movement 100 times and it was fine. And this one movement just set it off and it sucks. And I know this is going to hurt for a couple days. But the difference of totally catastrophizing and being like, here's the evidence that I am going to be like horribly impaired to the point of being in pain for the rest of my life. And this is awful to like the point of it's okay. You're safe. Your spine is safe. Like it is what it is. We know the tools to get better now. I think just employing like those pieces of the treatment for myself has helped me manage those periods of flare so, so much.
Yeah, Georgia, I totally agree. And you know what's interesting about that is I bet you learned that through Curable. Is that right?
Yeah.
I didn't learn it through Curable, but no one has ever talked to me about managing that or how it's going to be nonlinear or how it's okay to move backwards and not to become fearful of that and the importance of not catastrophizing that. And that is also something that would have really helped me if someone had talked to me about that.
That's interesting that so many of the early providers that you interacted with, like, wrote off your pain as a complex neurological driven pain, but none of them talked to you about management techniques of that
Yeah.
type of pain. Like, that's
Yeah.
shocking. That might be the most shocking thing I've heard you say.
Yeah, it was wild. And it was so confusing for me. Like they would tell me to manage my stress and I didn't know what that meant. I mean, obviously there were some periods of time where I was more stressed than usual, but I think also I was in this period of distress because of the pain suppression. So I was like, like what am I supposed to do with this information?
So previously, when we're introducing each of your stories, you talked about how, pain is now a part of the narrative of your life, and there's huge, huge social and psychological and physical impacts of pain on your life. Avoiding going out because you think it's going to trigger a pain flare or whatnot. So now you're on sort of like over and on the other side and knowing a little more about management techniques. In recent days, let's say, how has the impact of pain on your life changed? Like, do you still have those thoughts on like, I have to change the way how I do things because of the potential of pain or the severity of pain? Does it still impact you socially?
Mm. Oh man, it's a loaded question. It's changed in so many ways, and for me, it definitely still plays a significant role in my life, and it's still something that is often on the forefront of my mind when I'm doing things, but the narrative behind it is very different now. So, for example, with socializing, I've had to draw very clear boundaries for myself, and I usually listen to my body and what is working for me. And so if that includes not going out, that's not the end of the world. And I still have good relationships going on with my friends that are meaningful that won't trigger a pain episode. For me, I find drinking really flares my pain. So it dehydrates me, and the next morning I wake up and I feel like my head has like exploded, and not just like a hangover. Okay. It's a very uncomfortable feeling. And so that's a boundary that I've had to draw for myself, is like going out and drinking with my friends is something that I do very few and far between, and I pick my battles. And my friends have had to be okay with that and accept that about me and do other activities with me. So that's been an interesting line I've had to draw. And now I feel much more okay with like accepting that that's not something that really works for me all the time and going out and socializing in different ways. So I'd say, yeah, it still impacts my ability to socialize because unfortunately there's like a large drinking culture and that's a lot of celebrations these days. But often I'll go out and I won't drink, or I will just choose to stay in and make an activity that I can do with my friends beside drinking, and that fills my cup a lot more.
It's impressive that you're able to put up the personal boundaries because that's one I struggle with for sure. No, I think not to like open a total can of worms this far into it. My experience with pain is still so evolving and like how it's impacting my life. Really big part of that is because the actual physiological side of my experience has also been changing. And after all of this initial work, I finally had a doctor that was willing to go there with me of trying to answer why would this have happened in the first place. And I finally had a doctor say, "Has anyone ever looked at your hips?" And I was like, "What? My hips?" My hips are fine. And they did two MRIs and they were like, yeah, oh my God, your labrums are absolutely shredded to bits. And you have what they call FAI to a pretty significant degree, which is femoral acetabular impingement, basically meaning that the shape of my hip joints is not compatible. And especially in a sport like skiing, where there's a significant amount of force that is resisted and sustained throughout the hip joint, and especially in pretty compromising positions. And there's been no direct line to say my hips are exactly what caused my back pain, but it has been a progressing situation where I had my first hip surgery just over a year ago to completely reshape my right hip. So they go in, they shave down the bone of the head and neck of your femur. They shave down, at least in my case, because it was pretty significant, shave down the hip side as well and repaired all of the soft tissue. So I've still been in this like almost this weird meandering like initial healing phase mindset of like I'm still trying to get over like that initial hump of feeling like the patient of feeling like the person who has the active recovering injury. And it's something that I've actually been thinking about and reflecting on in the last couple of weeks. And I think being in physio school has put me here of I've been in such a mode the last couple of years since all of this information started to arise my senior year of like preservation above all else. Like my greatest fear in life is losing my mobility and losing my ability to recreate in the ways that I do and live life in the way that I do. And so I've been in this mode of like, all right, I can live life, but carefully. And we're not going to cause more damage, and we're going to get the hips fixed up. And I'm going to go in, I'm going to get my injections every 6 months so that we can, at least slow down the arthritis that has started. And I'm going to keep doing super expensive PRP treatments, like I mentioned before. So I've been in this kind of continual state of like, okay, holy man, we got to wrangle what we've done here and reel it back in. And so I think my experience of how pain has impacted me is my narrative is a much more positive narrative now where pain doesn't paint the picture. It's not the only thing, and it's not like the big looming dark figure in the corner. It's something that is still a really big part of me, and it's still very defining of me and my lived experience, especially as we progress these different medical interventions on my body. But it's something I've been reflecting a lot about of like, how do I get out of this patient mindset and accept that I'm probably going to live with some degree of pain, actually, probably inevitably for the rest of my life. But how do I get away from this feeling of fragility and like my hip is healed up? My back is my back. It hurts still quite a few days of the week to some degree, but like I don't want to be scared to use my body, in the ways I want to. And so that's still a hump I'm trying to get over. So I would say I've progressed from going into full-on blown panic attacks when I had a flare of pain and would spiral so hard and just be otherworldly to now I kind of have this relationship with the anxiety around my body's functions and this fear of long-term loss of mobility. And that's kind of the hump I'm trying to get over now.
Sometimes the analogy I use to help patients understand the reality is management now is imagine having diabetes. If you're diagnosed with diabetes, the reality is yes, you need to keep your blood sugar in check and adopt lifestyle changes to keep it under control. But it doesn't mean that your life is ruined. You can still have a great, meaningful, fulfilling life. But yes, you just need to manage your sugar, exercise, check your blood sugar, keep your feet nice and dry, things like that.
I think that's a great analogy, and it ties, Jules, to what you were saying of how your relationship with pain has changed now. And something that stuck out, the power of information, at least, even though it's still a complex experience, we're not pain free. We're not like, living in that blissful state. But it's also like I understand my variations of pain way better. I can understand why I might be experiencing one of my types of pain. I also have like 100 different types of slightly variant pain. And because of that, I can know which pain I can move through and which pain is acceptable and which pain is just like inevitable. And if I'm going to go do this active thing, yeah, it's not going to be pain free, but at least I have the information and like the control around it that I need to have so I can still participate to the point of your analogy.
It's a very important shift that now you are in control of pain rather than pain in control of you. Pain is a part of your life, but it's not the thing that your life evolves around.
And I think that's the issue is our life was revolving around it before, and now it's just like shifting out of that mindset. I think something that has really helped me is some form of acceptance of it's okay to do things in pain to some degree. Like with the exception of you're not causing further mechanical damage. It's okay if I have a headache or my neck is feeling particularly inflamed to go out and still go to the gym instead of like succumb to it and lay down and close your eyes. And it's like, yeah, laying down and closing your eyes is what your body is intrinsically wanting to do because you're so exhausted and you're in pain. But the moment that you take away all other stimuli, it's like your brain's just focusing on it and making it more real. You're letting it drive the choices you make instead of you choosing what you're going to do and your pain adapting to that. And so just continuing to be okay with doing things in pain if you're not causing mechanical damage, continuing to do your exercise and your socializing and trying to do those daily activities and not letting pain control those. And slowly but surely, I found that my pain listened to my responses to do those things instead of my pain driving my behavior.
That's excellent. Understanding when pain is safe and when it is not safe. There are some times when pain is not safe, but there are a heck a lot of times when pain is safe.
One thing I would like to add is that trust in the process is really important and can take away a lot of anxiety. It's like once you have found the right supports and you're moving in the right direction in an upward trajectory, whether it's going up and down, but it's slowly moving up, trust that process and keep doing what you're doing, even if you have moments of relapse. It just gave me a lot of mental peace and stability to just lean into it and be like, we're going to trust this process. There's nothing else I have to lean on. I'm going to lean into this as hard as I can and see what I can get out of it.
Yeah, that's great. Let's bring this amazing, amazing interview to a concluding section. So, as a person living with pain, what would you say to current and aspiring healthcare providers?
One thing that resonates with me, if I were to communicate something with future healthcare professionals, is to know your audience that you're speaking to because you need to know the amount you need to educate and when your education points could be deemed as condescending or you're speaking down to someone. And the flip of that is like assuming people know things and not educating them on it can be equally as destructive. I found that quite frequently I was getting educated on things that I already knew, but was missing a significant education piece in other areas. So know who you're speaking to, and instead of assuming knowledge or assuming they don't know something, ask and see what they know would be really helpful.
Yeah, those were really good points. Especially considering that we now understand pain as a perception too. So it's like managing that patient's own relationship with pain and like not making them hate it either by being like, well, that's stupid. No, I would say for providers, this is basically me giving myself a little bit of information too. I would say our entire line of work is derived from people experiencing pain in many multitudes of ways. And I think it's only right that we take it upon ourselves as providers to self-educate and to keep up with the research that's happening in the pain science world because it is such a newly evolving area and there are so many things rapidly changing. I think that there will never be a golden bullet on how we diagnose with the perfect balance between when do we focus on mechanical things, when do we focus on neuro things, when do we focus on social or psychological, or like there's way too many inputs to ever be able to like 100% say that's the thing, you know? But I think if we can understand in the most wholesome way of how it can all fit together as a puzzle, then you get to start interacting with patients as that really intricate puzzle. And to Jules's point, not hang your hat on like one piece of that puzzle and make the patient have a less than ideal experience with a physio or with a healthcare provider because their experience is belittled or isn't dealt with in a comprehensive way. And we can only continue figuring out what pieces exist in this puzzle if we just keep self-educating. Because, I mean, at least shout out to University of Alberta, our curriculum is doing a phenomenal job of education in the pain science realm and how it weaves into all of our other areas of education. But there's no way that they can be educating us in a classroom with pre-made curriculum that's even keeping up as fast as research is happening. You know, like the self-education just can never stop. And I think pain is I would argue, the most central point as a physical therapist of an area that you need to stay up with.
Yeah, and building off of that, it's taking that self-education, translating it to your patient in a way that they can understand and making sure that you are educating. I feel like the education point is missed so frequently in physiotherapy, and it is so critical. It sounds kind of like silly, like this concept of education, but when you really learn the impact it can have, it is so important to make sure we are educating patients.
Yeah. And the last thing I'd say, to just because that education piece is so true, especially in your story, Jules, providers that were able to maybe rightfully identify some complex pain components of yours that weren't coming from mechanical drivers, but they couldn't treat it. Like, they didn't treat it. They could identify it, but they didn't treat it for you. And I asked the question myself too, of like, how many physios out there know what a toolkit looks like for a patient that is experiencing complex pain with more of like the psychological driven components? Like, how many people know, okay, so we probably need to bring their stress and anxiety down. But like,
Mhm.
what do you do? Like, what are the tangible actions that you can offer, or resources that you can point them to actually do something, instead of just saying you should probably de-stress a little bit?
Yeah, like know when to refer, what signs to refer. If you don't have education in chronic pain or special training, know when to refer to someone that does instead of doing nothing.
That's wonderful what you've shared, the suggestions you're giving, and that is from a heartfelt lived experience. And kudos to you who are listening to Paincast and have stuck with us till the end of this episode. If you find this helpful, definitely share about this episode and the podcast with your colleagues, as always. Now, final question closing. Any concluding thoughts?
Final concluding thought is that people in chronic pain are exhausted, and them showing up to anything is a win. And just providing them with any support and cheerleader vibe is super important.
Yeah, resonate on that, Jules. Living in chronic pain is a friggin' big challenge, and it's a challenge that changes its look and shape every single day, it feels like. But it's really encouraging how many tools are out there and how many people care about researching this area and bringing better clinical solutions to the plate for us. But yeah, I would say look around a room. There's probably someone around you that suffers from chronic pain or complex pain more than you would think, because it's very easily masked.
Yeah. Thank you so much, Tiffany, for having us on and letting us share our stories. I know for myself personally that as much as it's difficult to talk about, it's also therapeutic at times. So, as much as this was educational, hopefully for a lot of people, it was also very, very helpful for me as well. So, thank you so much.
Once again, double down on that. Spot on, Jules. Thank you.
Thank you. Thank you for listening to this episode on Jules and Georgia's Pain Stories. Paincast is a freely available resource for you to advance your knowledge about pain and physiotherapy. We will continue to provide you with top-notch, evidence-based, and practically oriented content. To help more people know about this amazing resource, follow us, rate us, and share our content with your network. Follow us on Instagram at paincast.psd, where you'll find bite-sized knowledge in 1 to 2 minutes. You can also use the feedback form linked in the show notes to help us improve. Thank you again, and stay tuned for future episodes on pain and physiotherapy.